this presentation, I'm just going to kind of go through kind of the historical trends of hunger in the US and just a little touch about kind of the role that the US has played in the global kind of hunger picture and context. And then we're going to talk about the report that released. And then at the very end, I will teach you guys how to crunch the hunger statistics yourself. It'll be a very brief little crash course, but for anyone who's interested and loves that kind of stuff, I have more resources on how to learn how to do that more in depth. Um, so yeah, a little bit of information about me. I studied at global food security at McGill University, so hunger research has kind of been that's been my thing for my whole career. And yeah, some of my research before this, I was looking at the intersections between climate change and migration and food insecurity and the way all those kind of things and kind of global systems interact and influence one another. And so at Hunger Free America, I manage our national database of feeding programs. That's this really crazy map that you see. And that's also the link that I sent you guys in the chat, the findfood.hungerfreeamerica.org. Uh, it has, it's the most comprehensive database of food pantries, soup kitchens, SNAP offices, WIC offices, SNAP application sites. Um, it's a lot of data, as you can see through this crazy data visualization here on the map. And for the most part, it's pretty accurate. It's we've done some accuracy tests compared to some other similar databases, and we stacked up at the top, if not better than most of them. And so yeah, if anybody is interested in like data sharing or like your organizations have lists of food pantries or soup kitchens or anything that you're interested about the database, um, please reach out. I love talking about it. I love sharing data. I love talking about ways that as organizations we can share data more comprehensively and more timely. But yeah, this presentation is not about the database, so that just wanted to put a little plug in for that. Aside from our database, I do a lot of our internal back-end boring Salesforce admin work, just the back-end IT kind of infrastructure and all that as well. And then I do our research. So, um, to kind of tie in a little bit of like how anti-hunger work in the US really influences the global context, I wanted to show this historical chart. It's just from 1960 to 2020 because this is from an older report. We actually were published in an international journal, really going in depth about how the U.S. and the U.S.'s food banking model influence countries around the world. So if anybody's interested in this specific topic, we can share the link to that report as well. But in general, what you see is that decreases in hunger correlate with a stronger social safety net. Not a huge surprise, but it's just one of those things that we have so much evidence, like an abundance of evidence, and I'll get a little bit later on into the specific evidence of more recent times, specifically from the pandemic on, how that correlation is just so clear and how we need to really keep focusing and making sure that we are getting not only politicians, but I think also the more we can get folks in general, the general US population, to really understand what it's going to take to end hunger and the fact that we can end hunger. I think talking about these kinds of things is so important to really building that movement. And so you'll see here that right around the 80s, we have like a more steady increase. We'll kind of ignore the progress that we made there just for the sake of this point here. But what happened here in the 80s was we had Reaganomics, and we had a general shift from relying on the government to address hunger to more of a reliance on the charitable food distribution model. And so that's when we saw, more investments into the food banking kind of sector and that whole model and approach to hunger. I want to be really clear that food banks and food pantries and soup kitchens are all really critical. I'm sure you guys probably all know that, but they're also not going to be what's going to ultimately end hunger. The goal is we don't want people having to go to a food bank in the first place. That we want folks to be able to feel like they can, get whatever food and groceries that they need, and not really relying on these emergency kind of feeding solutions. And so, one kind of interesting thing that happened was after we had that shift, there were other countries really looking at our approach to hunger and kind of copying us to the degree that you can literally see the exact same floor plan for a food bank that you would see in the US, like that exact same floor plan all the way in Australia or other countries. And so that whole model was really exported across the country or across the world. And that was such a huge mistake because we were not, that was one of those solutions that, we weren't, that was one of those things that the US contributed to the global, conversation that was just really not good. And so I don't want to be like, as Americans, we tend to be a little US centric, but this really was one thing where other countries were looking at the US for how we approach and solve hunger. And so that's why I think that it would be so powerful if we can really lead the charge on actually ending it too. Because if we can end hunger here in the US, I think that would have a huge impact on global hunger as well. All right. So, more recent statistics here. This is from the USDA's Household Food Security report. And generally, we see that general decrease in hunger. And then once we hit 2021, it really skyrockets. And then I think the graph that really shows a little bit more of the story as to how those trends happen is this next one. So keep this chart in mind, but to me, this is the big one. This is the official and supplemental poverty measures. Stay with me here. This gets a little bit more in the weeds, but this is so interesting. And so please, if you have any questions or want me to re-explain anything, let me know because like this graph, I think tells so much of the story. Basically, the official poverty measure. This is what we've been using to measure poverty since I think like 1960 or so, and it really just looks at income. And as I think a lot of us are aware, there's a lot more that contributes to poverty and food insecurity than just your income. And so over time, folks started realizing, hey, this poverty measure really isn't super accurate because it doesn't capture things like the cost of living or non-cash benefits and those kinds of things. And so the supplemental poverty measure was developed. And generally, the supplemental poverty measure is regarded as the more accurate measure of poverty. And so, even though it's kind of confusing because, it is like the official poverty measure, but it's generally kind of the less accurate reflection of poverty in the US. What we really want to look at is the supplemental one. And so what happened here in 2020, this was the first time that the supplemental poverty measure had ever dropped below the official poverty measure. Generally, what we were seeing was that the official poverty measure kind of underestimated poverty by just a little bit. And, you can see that trend pretty consistently here. But what was so interesting about what happened in 2020 and 2021 was the pandemic and all these policies that we put in place to fight the pandemic. The stimulus checks, first of all, those were a huge contribution in why the supplemental poverty measure is so much lower, because all of a sudden folks had, a little bit more cash. But then beyond that, during the pandemic, we also had more like boosts to the SNAP program. We had the child tax credit. We had pandemic EBT. We had all these different programs and things to support families during, such a unprecedented time, and it worked. It worked. We saw a huge reduction in poverty, and that was just public policy. The child tax credit on its own, you can actually see there's a different set of data called the Household Pulse Survey, and it's like a biweekly to like monthly kind of check on poverty and specifically food insecurity and stuff like that. And when that child tax credit uh, like was enhanced and expanded, once that hit, we saw child poverty get cut in half. That was crazy, and you can actually like see that from month to month, and over time. And so, these policies work, and basically how we ended up back here, where everything was increasing, was because we rolled back all those policy changes, and yeah, we got rid of them, and not a surprise that poverty and hunger went back up. So, for our annual hunger report, what we do is we take that USDA data that I was just showing you guys, and we slice and dice it in all these different kinds of ways. We break it down by state, by borough, because we're based here in New York City. We always do a special New York City report. But you can break down that USDA data into whatever city you live in. Like you could calculate food insecurity in Chicago or wherever you're based out of, and that's something that like the little bit of training that I'll do with you guys later. Like there's a geographical thing that you could just really easily add in that layer and calculate more localized statistics if that's of interest to anyone in their organizations. And then we also break it down by different populations like children, employed adults, and seniors. And we take all those categories and break it down by state, like I was just mentioning. One thing that was kind of interesting that in this year's report was Staten Island was not included in our borough level report. I know not all of you guys are New Yorkers, but it's kind of interesting because Staten Island has just such a small sample size that there just wasn't enough data this year to be able to reliably report on Staten Island statistics. So that's just kind of an interesting behind the scenes thing that is worth keeping in mind if you guys ever do want to try to work with this data and report on it, is keeping in mind the smaller locale that you go, the less reliable it's going to be because it's a smaller sample size and less accurately reflects the region that you're trying to cover. In previous years, we did have this survey of food pantries and soup kitchens. That was one of my favorite parts of the whole report, but it was a lot of work, and I'm a small team. I'm the only one who does the research here. And so we had to kind of stop doing that just because it was too much work. But we are probably going to we're probably going to do a special standalone report just on that survey, probably in the summer. But part of why I mention this is because I think if we look at these numbers, we look at these statistics, we look at these trends, and it's really easy to forget about how each of these, percentage points and all that reflects real people, real stories, real experiences, real things that we're seeing across the country. And so those quotes are just this incredible, just treasure trove of resources of food pantry and soup kitchen staff really saying, hey, this specific thing is going on in my community and had had a huge impact on hunger. They're talking about nuances and the cost of living in their neighborhoods and all those kinds of things that just get a little bit lost in the sauce. And hearing these really just incredible, more personal stories, and also stories about how these benefits have really impacted people's lives. Lots of folks talking about just how much the child tax credit helped them out and those kinds of things. Like to me, personalizing those numbers is so important, and it's so important to always recenter any conversation about statistics around that. One recent report that we did just do that was a separate report from this annual hunger report was on the new summer EBT program, and we did have a kind of general open text feedback quotes kind of um, question on that survey. And yeah, that was just another really interesting set of just data and information and stories from folks on the impact that the summer EBT program had. Not a huge surprise if you know much about that program, but it didn't really change anyone's lives because it was such a small dollar amount. So the general consensus that people were sharing was like, yeah, it helped, and it helped them catch up on other bills and stuff like that. But it was such a small amount per child and for a short amount of time, and the implementation of it all was kind of a little bit of a mess. Um, but hearing those stories from people and the way that policy impacted their lives, it's just so incredible. And one thing in particular that was interesting in that set of quotes was I saw mentioned a couple times, which I usually don't see mentioned in these kind of story sections, but a couple folks were talking about the challenge of raising and feeding a child who's autistic. And it's easy to forget about all these different ways that the specific nuances of people's lives really influences the level and severity of food insecurity. And one mother was really talking about how her kid has this fixation on tofu because he's on the spectrum, and all he wants to eat is tofu. He doesn't want to eat anything else. And you think about how expensive tofu is. So she couldn't stretch her benefits quite as far as other folks because that was just the only way that her kid would actually eat. And yeah, so there's just all these different things that come to light with anytime you're able to draw the human experience into these statistics. And yeah, also in the report we have some data from the Census Pulse survey. That's that more monthly set of data that I mentioned, where we were able to see things like the impact of the child tax credit and all of that. That actually is ending, or it did end, but they're kind of revitalizing it for 2025, which we're really excited about. Part of why that makes a big difference is because this report covers 2024, but that USDA data that I was just showing you guys reflects 2023. And so there's this year lag in the data that we get from the more official, USDA report. And yeah, it was especially not so helpful in like the pandemic when 2019 compared to 2020 compared to 2021 were all dramatically different times. And so yeah, more current data is really helpful, and we're strong advocates of it here. So let's calculate some hunger statistics. But also before we do that, while I kind of send you guys the link and everything, um, give me one second. Do we have any questions? We're running pretty good on time, so please feel free to ask as many questions as you want. No, you guys are all feeling like hunger data experts so far. Cool. All right, so I just sent you guys the link to the database. Um, oh, I just realized it'll be kind of hard to show you guys the. Okay, so we're gonna have to kind of swap back and forth so you can see the instructions, but also see like what's going on. Um, so yeah, we're gonna start off with the census's MDAT portal, and what we want to do is, sorry, I gotta reconfigure how the Zoom layout is right now. There we go. So here in this data set, this is like all of the Census Bureau's different surveys and just such a tremendous like resource and just library of different types of data. You know, even just scrolling through here, you can see just so many different types of information and data on here. But what we actually care about here is this food, not the fertility, the food security supplement. So when you go to data set, you want to click that one. Luckily, it's the only one that has food security in it, so it's pretty obvious. And CPS, that stands for the current population survey. Um, and then the vintage. This is one of my favorite parts because it makes me feel like I'm selecting a fine wine. It really just kind of tells you what year. So we want 2023, and then we'll click next. And then the variable that we want is this one right here. I'll hold on. I'll pull it up here, and then you guys can kind of see it more clearly. That's HRFS12M1. That's like the official food security kind of variable. That's the gold standard. We want to click on that. Then we're going to go to data cart. And we're going to move all the non-responses because what we really want are, you know, people who have kind of filled out the survey and are either classified as food secure, low food security, or very low food security. That's the main thing we're interested in here.
Can we go back real quick to the data set that we have to pick? I missed it too.
Yeah, no problem. uh, yeah, so for the data set, just scroll down just a little bit here to the CPS food security supplement.
Thanks.
And thank you for slowing me down. I've done this a million times, so sometimes in my mind it's like, oh yeah, it's super easy. But
Well, it's all there anyway.
yeah, it took me a really long time to learn all this stuff, though. I had to figure out these variables on my own, um, and that's a whole other skill set and tool. What I'll put the variable name in the chat too. That might just be easier for everybody. All right, so we've got our food security summary, and then we're going to our data cart. This always makes me feel like I'm going shopping. It's extra fun when you have a full cart full of variables. And then we're just gonna uncheck this no response. So then we'll go to the table layout. Table layout's right up here. And then view table. And then the last big step, but very important, is this weighting here. So right now, the default in the way that the USDA reports on food insecurity, and this is really important because a lot of people don't understand this. And as hunger advocates, I think it's really important for you guys to like have some general understanding of this. But the way that hunger is reported by the USDA's measure is by household rather than individuals. And so it'll say like, you know, instead of 12% of Americans are food insecure, the way that they'll talk about it is they'll say 12% of households in the US are food insecure. And part of why that's interesting and important is because if you think about in a household, especially one with kids, you'll have, like the parent or caregiver uh, cutting back their meals to make sure that the kids in the household are getting fed. And so by talking about it at the household level, it there's a way that it kind of has this more flattening effect. Um, and so it's important to keep those nuances in mind as we're reading and thinking about these statistics. Um, but luckily, there is this weighting that can actually bring it to more of the person level weighting, which is what we do. This doesn't mean that they actually surveyed every single person in the household. It's just more so an estimate that based on that one household respondent's answer, we can kind of estimate then how many people, not only just in that household, but then in the country, are food insecure. And if all of that is good and set, if you've changed the weighting and everything, these are the numbers that you should be seeing. Um, and if you correctly got these numbers, then that means you're an expert.
There's a question in the chat about like how to define a household, but do like if you have roommates, like if you're living in an urban area, and uh, are you and your roommate a household or
That's a really good question that um, I don't know if I can confidently give the answer to. Because I think it's, I'm thinking back to like the general like the big US censuses kind of methodology and the way that households are grouped. And I don't know though. I'm not sure. I'm gonna look into that though. Whoever asked that question, I'm gonna follow up on that, and I can send out the answer because I never really thought about that. And then one last little thing I'll show you guys in this portal here is geography because I think that that'll be interesting for a lot of you guys. To me, and before, part of why I really wanted to teach you guys how to do this is because it is so empowering to be able to access all this public data that's just being generated for us and really utilize it for our own needs as advocates and folks in the hunger space. The more that we know how to actually use this data, the more we can really understand these problems and then go to like stakeholders in the community and better explain what's happening. um, and this is actually like really easy. I mean, hopefully it feels kind of easy to you guys. Maybe not. I don't know. But like, it's just great. Like, it's crazy that you can just go into this free data portal and then calculate the official USDA statistics yourself. Like that's just crazy to me personally. And I think the more people that know and learn how to do it, the better off we'll all be. um, and so another thing that is pretty interesting is you can break this down by geography. You can even do county. Let's go ahead and do a county. Does anybody have a large city that they're kind of interested in? Anybody? Oh, can someone read the chat? I have to. It's
I
like,
see a vote for New Orleans, Boise, Los Angeles is in there.
all right, we got a couple requests. Let's do one with New Orleans first. Um, Louisiana always has one of the highest rates. Um,
Denver.
Okay, so now this is always an interesting part of like trying to figure out what county exactly is a city because it's different in every single city. Some cities are just one county, whereas other cities are made up of a collection of counties. So let's look up New Orleans. County.
He's saying in the chat parish. Like
Parish? Okay, that was
yeah.
the Orleans Parish, I'm assuming.
Hmm.
Cool. D table. And there you go. There's your New Orleans statistics. Although you can see they changed it back to the household weighting. Oh wait, never mind. Sorry. No, this is person weighting. I was wrong. Sometimes though, when you change things up, it'll like throw you back into the household thing. So that's just something to always double check that you've got that. Do we have any other questions, requests in the chat?
Yeah, there's one for Denver, Colorado, and then Los Angeles is in there as well.
All right. So one thing we want to do is we want to go back and clear New Orleans. Um, yeah, okay, so we'll get rid of that. Let's do Denver. We got Denver. We got a view table. And there you go. And I'll go ahead and show you guys part of what I was talking about with the sample size and stuff too, since we're talking about locales. Um, Something that happened with Staten Island is they said that there was zero food insecurity in Staten Island, which is not true. And that's because there just wasn't enough. If you're ever in a situation where you're like looking at these statistics and you're like, oh, I don't know, like this might be a situation where the sample size might be low, like and it might be less accurate. If you ever want to check, you can just go to that weighting and click unweighted. And what this does is it shows you exactly how many people responded to the survey. And so this means that 49 people in Denver um, answered the survey. Three of them had low food security, two of them had very low food security, and then 44 were food secure. And then all that the fancy weighting and formulas and that's a whole complex calculation that I don't even understand, but I don't really need to. That's their job. Um, but then that then gets multiplied to reflect the population in Denver. And then I think another one was LA. Let's do
Yeah.
LA. And how about with LA? Let's do something fun. Oh my God, I'm blowing past Colorado. We can with LA layer in children, because why not? Los Angeles County, view table. So yeah, these are the LA statistics, and this is one of the great that like LA, since that's a much bigger city than Denver. Um, LA, you never have to worry about the sample size. It's always going to be accurate and totally fine. But if we're doing that for like Rhode Island or Vermont or God forbid a city in Vermont like Burlington or something, then yeah, then we got to start worrying about the sample size. So yeah, if we wanted like another way to kind of utilize this data is we could throw another variable in here. Why not? The world is our oyster. Um, the age one, it I'll show you guys actually how to even like find this. You could in this label search the thing that you're kind of interested in. Um, of course, labor force isn't at all what we want, but this demographics one is the correct one for age. Um, you can in general kind of poke around all the different types of labels and variables in here if you're interested and just get a sense of the possibilities of the ways that you could analyze this data because there's just so many different types of ways you can look at it. But if you ever want like full clarity on what a variable actually means, there's a lot of documentation explaining for you exactly what it is. Um, so yeah, I just set this to an age range of all respondents from 0 to 17. So that's for children. And then we go to our table. And that's not correct. Hold on. Let's figure out why. um, oh, right. Over here. So you can see it's averaging the age, um, which we don't want because the age was only 0 to 17. That's why we're getting like 9. um, so sometimes you want to double check this, and if we just change it to count, then we've got the number of food insecure children in LA. Any other like questions, requests?
If we have time, there was one more city put in there. If we could search Boise.
Sure.
Yeah.
Um, I'm going to remove the age and just do a more straightforward Boise, Idaho. Uh-oh. Okay, so apparently Idaho had too low of a sample size. And this actually sometimes if they don't have enough respondents for certain locales, then they won't provide it. They won't give you an option. So the best we could do, the best we could do is the state level. Um, and yeah, so that's how you would just do the state. I'll throw Illinois in here too, just so you guys can see what it looks like when you put multiple states in. When I do my calculations, I just check all these states and then kind of look at them all at the same time. Um, but yeah, that's the number for Idaho as a whole. Unfortunately, that's the challenge of doing this work in rural areas is we tend to not have data because we're so small. And the same thing with like more like smaller population groups and stuff like that. There's always such a huge struggle for accurate data and information, not just on food insecurity, but in general with like smaller populations like Native Americans or transgender, genderqueer, non-binary folks. Like anytime you're getting more granular with a population, whether that be geographically or just as a whole, um, unfortunately, we tend to not get accurate reflections of that data, um, which is especially unfortunate because a lot of times those are the places we need to um, learn more about the most because those are often the more vulnerable folks and groups. Um, do we have anything else in the chat? I think I saw like a little notification, but I couldn't read it.
Um, no new suggestions, just not surprised, she said about
Yeah.
Idaho. But it is a good spectrum of somewhere like LA and then somewhere like Boise that doesn't have the sample size.
Yeah. Yeah. And the thing that we do, especially with the sample size, um, you guys might find this interesting. Hold on, I'll stop this and I'll show you guys the behind the scenes spreadsheet. Just because it is kind of interesting the way that numbers can vary. Um, okay, so I'm gonna show you guys the official spreadsheet that is where I like keep all the data and information that I end up um, converting into the report. This is the magical, very complex, not at all. It's an extremely simple spreadsheet. But we do 3 year averages. So we average 2021 to 2023 just to make it a little bit more accurate because of those sample sizes. Because like we were just talking about, like California, plenty of people there. We don't gotta worry about the sample size. In general, if you look at the trends for California, it's pretty consistent in the sense that it's like a very clear, steady increase. But if we go to somewhere like like DC, for example, that's where you see a variation. And so when you're crunching these numbers and you like look across years, if you see something where there's like a huge jump or something like that, that can also kind of be an indication that you might have like a smaller sample size, which is creating more variance and more kind of room for error. But by averaging it, we're able to actually look at those groups and kind of flatten it to make it more accurate. You'd see the same thing with like Rhode Island. Um, there we go. Yeah, Rhode Island, we've kind of got the same thing here. Any other questions? It could be about anything too. I'm so glad that you guys are finding this helpful. I do have documentation on the exact step-by-step combination of variables and the exact way that I calculate the entire report. So if you want to take my job, there's documentation on how you can do it. I would actually love it if somebody just just does that. Take it off my plate. I don't want it anymore. Thanks for joining. Perfect. I'll talk to you in August. Yeah, yeah. Let me pull up that international report. That one honestly is like super interesting. I would recommend like people check it out. Um, and it was written by our CEO and myself. So it's one of those few academically published papers that is actually readable and understandable in like the English language. I don't know if you guys have done much academic paper reading, but sometimes it's just so dense that you're just like, oh my god, this is, yeah, crazy. Um, I'm so happy to hear that, Sam. Um, yeah, and if you guys are ever like trying to figure out how to look at data in your area and you just have some questions, maybe you want to look at a category that I haven't looked at yet, like disability or something like that. Um, I I've gone through the process of reading the technical documentation and trial and error and recreating and figuring out how to like get the right methodology. And so I'm more than happy to help you guys out and kind of working together and figuring out how to get whatever data is helpful for your local areas. The other cool thing that I learned in doing this work is you can just ask the authors of the report. Like they're very accessible. When I was learning how to do all this stuff, I would email the authors being like, "Hey, I'm trying to like replicate, children and my numbers are coming out a little differently than the numbers you provided in the report. Can you help me out?" And they were so helpful. Like it's always incredible to me that like there are so many individuals that are like they love talking about their research. They love talking about um, all the nuances and how to replicate what they do. And they're just so eager and ready to share. Um, so yeah, that's another thing. Like, don't be afraid to just email Matthew Rabbit. He's the main author of the Food Security Report. They're all super helpful. Um, and yeah.
Yeah, and fun fact that one of the key keepers of USDA data is a VISTA alum. So Alicia Coleman Jensen is got her start before she went to grad school. She was a VISTA.
Yeah, and Alicia was one of the main ones that really helped me out from the jump. She was the number one author for quite a few years. I noticed just this past year, I think she has moved on to other things, but yeah, no, an awesome Vista alum who I've chatted with many a time. She has saved my life when I'm bashing my head through a wall because I just don't understand what variable is what. Awesome. I'm so glad to hear that, Emily. Yeah, and that's the other thing. Like a lot of this stuff is really great little, you can totally simplify this into just more accessible information for folks in your area, like on social media and stuff. Like the more we can just talk about this stuff, the more we can just share this information, I think the better off we all are. I can't believe how many friends I still have who still really think that the best way to fight hunger is through donating a can of soup once a year. I don't blame them because it's just that thing that we grow up with in our society. But I can't believe that they're my friend and they still haven't heard me go on that rant yet. So you can never talk about this stuff enough, and sharing it and all that. That's one of the best ways to get the word out and really change that public perception on food insecurity. And actually, one last thing I really want to share on this that has really been sitting with me as we're watching hunger increase is, we're seeing hunger be at levels that we haven't really seen before. And so that means you probably know more people who are food insecure than you probably ever have. And that also means that you're probably, on the spectrum of food insecurity to food secure. A lot of folks are probably closer than they've ever been before on that more food insecure spectrum. And so I think like sometimes it's really helpful to remind folks about the larger scale context because when you're experiencing food insecurity, everything just gets so small, and you're just like looking at all these different individual things and factors in your life, or whatever, that's just the stresses of going grocery shopping and stuff. And the more that we can really ground, I guess, the narrative and everyone's understanding about how food insecurity is higher than it's been in quite a few years, the more I think validating and empowering that is for folks, in the way that they can understand, like, okay, I'm struggling, but I'm struggling with like such a large portion of the population, like like we're all struggling, um, to some degree. I hope that made sense, but like I do think that that's something to keep in mind about like your personal lives, your friends, your networks, and also maybe um, your own experience. And similarly, like send that link that I sent in the beginning, the Find Food website. Uh, the more we can just get resources out for people. A lot of people are a little too ashamed to admit or mention that they're experiencing food insecurity, so you'll never hear that from them. But you'd be surprised how many people probably do need to like learn about these resources of you know what they need to access benefits and food pantries and soup kitchens.